Hi everyone, this is Dr. Pasunuti Sumanth, Consultant Pediatrician. As we are in the winter season with temperature dropping, there are many children who are going to develop the wheezing symptom in this season. So, I have come up with this video to address the concerns of the parents regarding their child's wheeze. As soon as the doctor advises the nebulizer treatment for the child, the first and the most common concern for any parent is, does their child have asthma? The answer would be no. Probably not. Many babies and young children wheeze due to colds or viruses and don't develop asthma when they are older. Remember, young kids are more at risk for wheezing because their airways are very small. When they get a cold or other respiratory tract infection, these already small passages swell and fill with mucus much more easily than an adult's. This is the reason for which the child is developing wheezing, coughing and other symptoms that people with asthma get. And another important thing to consider is how often your baby wheezes. One instance of wheezing is not enough to diagnose asthma. It should happen more than once. But even when wheezing happens a bunch of times, it still might not be asthma, especially in young children. Most kids who wheeze as infants outgrow it and don't have asthma when they get older. So doctors usually can't make an asthma diagnosis until children are older by about age 4 or 5. Remember the fact that 1/3 of the children will have at least one episode of wheeze before their 3rd birthday and half of the children will have one episode before the age of 6 years. Now you can imagine how common it is to have a wheezing episode in children. In the meantime, doctors will treat any asthma-like symptoms. They might prescribe asthma medicines but probably won't officially diagnose a child with asthma unless symptoms continue. Share your concerns with your children doctor and ask about the possible asthma condition in your child if your child has following symptoms: wheezing episode that has happened more than once, and the long-lasting cough or cough that gets worse at night or after active playing, or any other breathing problem that concerns you. Asthma may be hard to detect in young children because they can't explain how they are feeling and the breathing tests are not as easy to do. So, watch for these signs in your child. The doctor may ask if your child has breathing problems in different circumstances, such as during a cold or when exposed to cold air, allergens and smoke. It's always important to tell your doctor about any family history of allergies, asthma, eczema and sinus problems. This information and careful monitoring of your child over time will help the doctor decide if the symptoms are due to asthma or other problem. So, stop panicking and remember, all that wheezes is not asthma. And thanks for watching. If you have any further queries, please do ask us in the comment section.